Hi everybody. As was introduced, we're going to concentrate on the benefits of the project that was delivered at Leeds Teaching Hospital over a fair period of time. For those of you who know anything about Leeds Teaching Hospital, you'll probably know that it's a very, very big trust, 15,000 staff across multiple sites. Just knowing that and knowing how hard it is to implement any change in the NHS, you can imagine how big this project was. And it did take a bit of time. Not surprisingly, in a trust of that size, there was a large variance in the different ways different teams and different departments chose to manage their clinical documentation production. So there were pockets of staff who were still using analogue dictaphones, some were using digital dictation. I think there was even a teeny bit of outsourced transcription. But definitely there was no overlying way of doing it the right way in the trust. And it came to a point where the trust decided to implement a new strategy in this space, and this was really brought into focus because there was a new sequin target imposed on the trust by the commissioners that required the trust to send out outpatient clinic letters within a fixed SLA. This is quite a common sequin that's happening to a number of trusts up and down the country, but it certainly brought clinic letters into focus for Leeds Teaching Hospital. So they went out to market, and through a procurement process, they selected Winscribe. And like I say, it wasn't about delivering something for one department or one group of users, it was for the whole trust. And the solution they selected was actually one of a combined digital dictation with speech recognition and obviously the workflow engine that goes with it. And this was, I'm happy to say, was well thought through and was delivered as part of a wider transformational program. So, there's lots we could talk about. It was a long program and has delivered a huge number of benefits. In parallel to this little talk we're giving now, there is actually a white paper that Winscribe are publishing, and I believe you're all going to get a paper-free copy of it before you leave today. So do take the chance to read it electronically somehow. I don't think they're giving us each an iPad, sadly, but you never know. But through some method, hopefully you will be able to read all of it and actually see all the benefits. We're going to concentrate on a few of them today, just to bring out some of the ones that have been achieved in Leeds, and hopefully you'll hear some themes that we've already heard of today, because actually many of these benefits have been achieved by lots of users of Winscribe. So we split them up into some groups here just for ease of covering them, and I'm not going to cover all of them because we have got limited time. But as with other trusts, one of the key benefits was about producing faster turnaround of clinical documentation, and that was absolutely key for the trust because that's one of the main reasons they chose to go ahead with this program. But other elements that were very important for clinicians were the ability to prioritise, as we just saw in that excellent demonstration, so that important letters were at the top of the pile for processing. There was a clear audit trail. Leeds, as part of this deployment, actually integrated a full integration with their PAS, so that the clinic list was being pulled through into the Winscribe solution so that clinicians could pick their patients. One of the key benefits here, of course, is that every single patient was accounted for. So in the past, when you were using an analogue tape, it was very easy to forget to dictate on one patient when you're in a rush, or even a patient who DNA'd may not have actually got a letter typed to that effect because they just got forgotten. But by having all the patients on a list in front of you and picking through them, you can see which ones you haven't dealt with. It's very hard to forget to do that, to cover all the patients that were allocated to you in that clinic. Again, through the use of templates, they were able to benefit from consistent quality and structure to their clinical letters. Again, this has knock-on benefits further downstream. Not only are people who read the output of these letters frequently able to find the information they need more quickly, but colleagues can also do the same. And then finally, another huge benefit for the trust was a single database. So all these clinical letters across this giant trust were ultimately all being collected in a single database. Prior to this, individual departments each did their own thing. So some would keep them on a local hard drive or on someone's server somewhere else. And of course, if you were in the dermatology department and you wanted to know what had happened in obstetrics, you'd have to ring up the obstetrics secretaries. No longer. Any letter that is now processed through the Winscribe system is available to all users in the trust at any time. And this is particularly useful out of hours in emergencies when actually the medical record itself, the paper record, may not be available, often hard to get, or maybe on a different site. And actually the only tangible data you can get on a patient is actually something from the shared database. So this is a huge, huge benefit from a clinical safety point of view. In parallel to this, obviously, with lots of operational benefits, some of which we've already heard about today from other speakers, but one shouldn't underestimate the ability to see in advance the bottlenecks as they build up in different departments and share the workload as and when is required to ensure that the peaks and troughs are smoothed out. And if there is a big peak in one department, another department with a bit of a lull could perhaps help out and make sure that those SLAs for getting the letters out the door are maintained. From a technical point of view, we've talked a little bit about technology today, but again, as a junior doctor myself, I used to find hunting down tapes prior to a clinic was almost more difficult than the clinic itself. They seemed to just disappear into thin air, and I, being junior, wasn't entitled to go and get a new one out of any cupboard. If there was such a cupboard, I never found out. To the extent that I once even had to go out and buy my own tapes, just because it just seemed like the only solution. But tapes have become a thing of the past at Leeds, and quality audio is now available to all, and it's accessible to all as well. So if for any reason the transcription doesn't happen, in that scenario where an individual might be admitted over a weekend, even if that transcription hasn't occurred for whatever reason, the clinicians could potentially listen to that audio and hear valuable data about that patient that may or may not influence the management of that patient in the emergency situation. And similarly, yes, there is some hardware to be bought in order to implement this new system, but at the same time, there's less dictaphones, less get lost in between clinics or pass from clinician to clinician and so forth. And the other thing, aside from the tapes that I used to spend a lot of time chasing, were batteries. And again, that seems to be a thing of the past. So lots of key benefits. One of the ones I haven't highlighted on this particular slide, which actually I think is probably the most outstanding one of all, is that along with documenting all these benefits, Leeds have been very proactive in managing the detail of some quantitative benefits. We all know that clinical transformation is hard to do, and then it's even harder to measure, particularly using really hard indicators, but Leeds have managed to calculate that they are saving £1.2 million, and that's a recurrent year-on-year saving that they are making. So it's really to be congratulated. Really impressive, not only that they've done it, but they've actually been able to quantify it, and it's been corroborated by the finance department in their rigorous ways. So that's a huge, huge achievement. But that aside, what do the actual end users who are using the system have to say? Because actually, these are the people that whose lives have been changed dramatically through the use of the system, and what's been important for them. And actually, some of the things they say, as you'll see on the slide, are slightly beyond the sort of softer benefits. They're things that perhaps one would never even think to put in the business case, but nonetheless have a huge impact. So one example was a secretary who told me that in the past she'd have a pile of tapes, but you would never know exactly how much dictation was on each one. So if it's 20 minutes before lunch, you think, oh, I'm not going to start another one now. That could be another hour, and I hate breaking it up. But with the Winscribe solution, she's always able to see exactly how much audio there is against each piece of work. So if she sees that it's a 30-second piece of audio, she knows full well that I can get that done before lunch and still make it to my lunch appointment or whatever it might be. So actually she's become more efficient in that space. Another really important feature that I heard again and again from some of the secretarial staff at Leeds was the fact that they had not appreciated how much time they spent chasing, tracking in, tracking out, on the phone, trying to find hard copy notes, because through the implementation they are using the paper records far, far less. In some departments they're no longer printing a copy for the paper records, they're just using the copies that are stored on the central database, which makes full sense to everybody. So consequently, even though the paper records might be pulled for the clinic, they're not then being transferred or carried, which again is another big job for somebody, back to the secretary's office until the letter has been processed. They basically go straight back to medical records. So they're not wasting or spending a huge part of their day looking through what they individually described as actually health hazards in terms of big piles of paper and clinical records that would be in their offices, taking up valuable space and causing a health and safety issue. So that's another huge benefit that actually often gets overlooked. There was also a consultant, interestingly, in oncology who had the same experience as the lady we heard about at Birmingham Children's Hospital, in that she found that some of her letters had been dictated and were ready for signing, had been transcribed and were ready for signing before she'd even finished her afternoon clinic. So again, there is the potential for a letter to be ready to go into the post or delivered via email, potentially even before the patients got back home after their clinic appointment. And that's a huge change to what we heard about earlier, of letters actually sometimes taking even up to a year. I've never heard quite that length of time, but I hope not. But that never was never that situation in Birmingham, from my understanding. But anyway, they're definitely, the turnover time is incredibly improved, and to some extent even on the same day. So that's a great improvement. And then another kind of softer benefit that's worth pulling out here again, because it's one people might not think about particularly, but one of the secretaries likes to do her work in a certain way, and found that with the old analogue dictation method, each letter had to be printed separately and collected from the printer and then folded up, and then she'd get on with the next piece of work. But through using the Winscribe system, she's found that she's able to batch up all her printing to individual points in the day that suit her. So you can imagine, particularly as many trusts are now using centralised printers that may be quite a long way from where the secretaries might be sitting, they're now able to print out a batch of letters in one go and go and retrieve them at a time that suits them. So you're not left with the dilemma of loads of paper with potentially confidential information being left on a printer, or actually being forgotten altogether and never actually making it into an envelope or to its destination. So again, a number of benefits that actually I think are worth pulling out, because they're slightly off-piste and ones that are easily forgotten, but nonetheless make a huge difference to the people using the system. I will reiterate that there are lots of other benefits that are covered in quite a bit more detail in the white paper, which hopefully you'll read later. What I'm going to do now is pass you on to Balbir, who's going to tell you about what leads are planning for the future. Having done all this, they're already thinking forward, how can they build on this fantastic foundation and achieve even more benefits. So, Balbir.
Thanks, Anna. Good afternoon, everyone. It sounds easy, but it wasn't. It was probably 3 of the hardest years that we had within the organisation, and we've worked through delivering those benefits, and they are worth it. But at the time, you have to question whether the pain really was going to get you there. And I think if you don't convey that sentiment, I wouldn't be doing justice to my organisation, who just hung in there with us, because there were times where it took secretaries longer to do the work that they needed to do. We were reprofiling the secretarial workforce, so it was turkeys for Christmas, and why would they really want to buy into that? And we were breaking long-standing interpersonal relationships between clinicians and medical secretaries, which is a really dangerous thing to do. Career limiting at times. We got through that, and I think the reason why we got through that is that we worked in partnership with Winscribe, and we were clear about the benefits that we were trying to achieve. And we do talk about patient safety, clinical care, delivery, efficiency, all of those things, and we never lost sight of those things throughout this process. That's why we kept going. Otherwise, I'm sure there are lots of people in the Winscribe team that will say that we were all ready to call it a day. We've got through that, but where it's taken us to is we've formally closed the project, but we've recognised that there's more to be done here. It's forced us into a paper-like world sooner than we were actually ready. So business continuity has become a big thing. We've got this central repository of letters, and clinicians now rely on that as part of their consultation. So whenever Winscribe goes down, clinicians ring board members to say we can't treat patients. And it will surprise many of you that we don't have 24/7 IT support, although hospitals have worked in a 24/7 environment for as long as we know. The IT, the infrastructure to support that is not 24/7, and so we're not able to respond quickly enough, but we are now directly impacting the care delivery process. So for us, solving the business continuity problem has become priority number one. So we would have liked to have done some of the more exciting, innovative things, but actually making sure that the system is resilient and up all of the time has become our focus. Winscribe are delivering a solution for us later this year, but as I say, it's on clinical risk registers. It's given us a taste of what Paperlight is going to feel like, and I suppose maybe I'm grateful for that, because it's getting our heads around what does business continuity in this world really look like, because our current business continuity plans are, if the system is down, revert to paper. Well, there is no paper. And so if there is no paper and you need to treat the patient, what are we going to do about it? And it has sharpened the minds of people, my IT colleagues, who are thinking differently about what their service means in a hospital. What we'd also like to do is, we've got a paperless solution here, but what we do is we print it out and we send it to GPs, and they then scan it and put it into their systems. There's something not quite right there. We need an improved e-distribution solution so that we can keep what is paperless throughout its entire journey and stop creating the paper going forwards. So improved e-distribution is a big thing for us. So we've prioritised that on our agenda. And this isn't about cost saving, is it? This is about, if you're using technology to improve the way we deliver our processes, doing it end to end rather than just doing bits in silos. So that's the bit we've got to get our head round. We want to harness speech recognition, and we want to do that in our EPR that we're building. So we've got technically savvy clinicians who want to use the technology and see what it does from them from a clinical point of view, because it allows them to share what's in their heads very quickly with their clinical colleagues. That's really, really important to us. So we want to help them to do that. When I talk about opportunities for service redesign, the project got very, very hard at one point, and when we realised we'd got as far as we could go with the organisation, we let them get on with it. So we haven't fully deployed speech recognition with every author. We've got a third of our authors using speech recognition. We don't have our secretaries working in larger clinical service units. They still work in specialty teams, so there's better efficiency to be gained there. There are improved ways of working, but we've almost got to let the organisation get to that point itself. We had to prove that the technology was good enough and it could deliver those benefits. And once we've done that, we've now left that as a message for the organisation. So I think there's more we can go at, there's more we can do, and obviously that will answer some of the 30 billion challenges that we've got going forwards. Text analytics, because we had this letter database and because there are now lots of things we know about our patients, it's how do we use that information and how do we make it work for us. So we've got coders that leaf through pages and pages of information, but actually there'll be things that they miss. And we have this big challenge around comorbidities. How sick are our patients, and do we reflect that appropriately? We all know that affects tariffs and HRGs and payments, but it affects clinical quality. It affects the way we represent clinical outcomes. It says, did we do the right thing for this patient and did we provide harm-free care? So we want to use the information that we've got there, harness that and play that forward so that we can use it in those wider environments. So those are just a few of the things that we've got planned for the future. Thank you very much.
Thank you.